Okay. Welcome. Okay, so we're going to do some TCM talk today, traditional Chinese medicine. And we have Brittany here. So, Brittany, take it away.
Hello, hello. I am super excited to talk about this topic. It is the way that I live my life after doing this course. It's changed the way that I live my day-to-day life, and it's changed my massage practice substantially. So this is a good video for anyone who is a practitioner, but also just anyone wanting to learn about how Chinese medicine can help improve their health and their life. So you can see on my screen here, I'll be doing a little bit of a slideshow and talking at the same time. So we're talking about traditional Chinese medicine. A lot of people obviously have heard of the term acupuncture. And what they don't realize is actually acupuncture is just under this umbrella of traditional Chinese medicine. You can get acupuncture done by physiotherapists and chiropractors, but the theory that they're using is different than the Chinese medicine theory that we would be following. So we'll delve into it a little bit more.
Okay, that's good to know.
Yeah. So when you see a physiotherapist for acupuncture, they're typically doing what they call dry needling or IMS, intramuscular stimulation. And so what they're doing is using the acupuncture needle and just placing it directly into the muscle that they're trying to release. Um, Oftentimes it's an aggressive needling technique. They're just kind of hammering it in and out and trying to get that muscle to release. I've had a lot of clients come to me with not a great experience of acupuncture. And when I asked them, was it done by the physio or did you see an actual acupuncturist? 9 times out of 10, it's usually they've had a bad experience with the non traditional acupuncture, the acupuncture being done by the physio and the chiro doing this intramuscular technique. So, if you have had acupuncture, I would advise you to look at who the practitioner was that was doing it. If it put a bad taste in your mouth, maybe seek out an actual Chinese medicine practitioner and you might have a much better experience.
Okay,
Not to say
because
that physio and chiros aren't good, right? I don't want
yeah.
to put
Well,
that
no,
out
but
there.
now that you said that, I had it through a physio.
Okay.
So, if I went to you, it would probably be different than what they did.
Big time. Big
Okay.
time. Yeah. The theory is completely different of what we're needling and why. So I'll go into that a little bit further. So we've also often seen this yin and yang symbol, right? And it is pronounced yin and yang. Lots of us like to say yang.
I thought it was yang.
And it's yang. It was something that I learned right away on like the first day of acupuncture school was like, oh, it's yang. Okay, I've been saying this wrong all along. So yin and yang. And so that is the foundation of Chinese medicine is this yin and yang theory. And yin and yang are always in constant movement. And so I'm saying here that they're two opposing forces that are always in motion, they're always changing. And so when we treat any disease or dysfunction in the body, we're working to balance the yin and yang and bring them back into equilibrium. And it doesn't matter what we're working on. It could be musculoskeletal, it could be mental emotional, it could be even things with the organs like stomach pain, or we were talking about like the kidney stones, things like that, cold and flu. We're still categorizing all of these things into yin and yang. Okay.
That's cool.
So to break that down a little bit more, we can think of the aspects of yin are they are cooling, it's slow, it's nighttime, it's feminine. If we're talking about seasons, it's the winter. So that is like the aspects of what yin is, and um, the substances in our body, right? Like blood is very yin. The fluids in our body, that's all very yin substances. And then in contrast to that, we have yang. And yang is warm or hot. It's fast. It's daytime. It's energy. It's masculine. It's summertime. Um, so it's the complete opposite, right? And so the goal is always to balance the yin and yang.
Mhm.
Yeah. The next pillar of traditional Chinese medicine is this meridian theory, and we've all heard of meridians. The picture to the left kind of shows a little example of how there's literally acupuncture points on every square inch of your body. They're everywhere. They're on your head, your back, your front, the feet, everything. And they're typically running in, what am I trying to say? Not vertical. Vertical? Yes,
Horizontal?
vertical.
Vertical,
Vertical
yeah,
as
not
opposed to
horizontal.
horizontal. Yeah. They're running vertically down our body. And they either go from head to toe or they can be running toe to head. And so when we're needling these acupuncture points, depending what we're trying to achieve, we might go with the flow of the meridian or we might go against the flow of the meridian. And it depends on which meridian you're working with. There's 12 main meridians, but there's a whole sub level of meridians underneath that. But we're in this conversation, we're pretty much going to stick to like the main primary 12 meridians, which basically encompass like most of our major organs, the heart, the liver, the kidney, the stomach, the lung, and the pericardium, to give an example of most of them. So yin and yang and meridians, those are kind of like what make up this theory of Chinese medicine. And so when we're needling in accordance to the meridians and what we're trying to achieve with the yin and the yang.
How do you know what somebody needs?
That so the intake process is a lengthy one. And
Okay.
we are going to ask you questions that you're going to have no idea why we're asking you that. We're going to right, we're going to be talking about things like your sweat, your bowel movements, your sleep,
Oh,
your general body temperature. So there is definitely a concept of constitution. So the body type that we're just born with naturally. So some of us are more prone or just born more yin or more yang. So for example, you know those big robust men and they have like a red face and they're just, you know, that's very yang. Their energy is yang, their face is yang, it's red and it's hot. And then you have somebody, I feel like more like myself. I'm quite like soft spoken. I'm a tiny frame. I'm always cold. And so I definitely have a yin body type.
okay.
So that's kind of like a precursor of like what somebody's coming in with. And depending on what we're trying to treat, I'm going to ask questions to try and figure out is the yin or is the yang off? And in what meridian is it off? So it's
Okay. And that's
really
all within your intake form.
exactly. I'm going to
Okay.
ask a ton of questions about bodily functions and whatnot to find that out. And it's just a nice big puzzle. And it's what I love about the medicine because if Western medicine isn't explaining something, we can use these puzzle pieces to figure out something else that's going on that you would just never even begin to think is a thing in Western medicine, right?
Okay. Good to
So
know.
who can get acupuncture is honestly just about everybody. You can needle infants, like, you know, babies, all the way up to senior citizens. The biggest difference is going to be the technique that we're using on you. So that means the length of needle, the thickness of the needle, how long we're going to keep the needle in the body for. All of that changes depending on the constitution that we're talking about. So with babies and elderly people, we're going to pretty much put that needle in and take it right back out again. We're going to stimulate the point and then get it out of there. It's very fast. As opposed to those big yang type guys who could probably handle a thicker needle and have it in longer. So that's a big,
Okay.
yeah.
Yeah, no, I always thought that they stayed in for a period of time. So that's not true.
Totally dependent on what you're treating. So
Okay.
if there's this concept of excess and deficiency.
Mm.
So without going too far into that, it's so say you had a cold. That is an example of a excess condition. And so I want to keep those needles in longer to pull out that excess. if it was something like you have really weak digestion, then I'm going to stimulate your stomach point, but I don't want to overhammer it. It's already deficient. So I don't want to take too much out of it. So I'm going to be a lot more gentle with my technique.
Oh, okay.
Right? Yeah. So you're right. Like kind of this like magical time is about the 28-minute mark for most things. Like definitely musculoskeletal, you're typically going to have them in for about 25 minutes.
Okay.
Yeah. But if it, like I said, if you were the babies or the elderly, we maybe wouldn't leave it in that long.
Okay. I
Yeah.
didn't even know that needles were different thicknesses either. I just thought they were all the same.
No, they're all very, yeah, different thicknesses and made out of different materials as well. You could even get, like gold plated acupuncture needles if you just want to get really bougie about your acupuncture.
Okay.
Yeah,
Didn't know that.
yeah. But yeah, no, they do come in different thicknesses. Some you can literally bend them in half. They're so thin, and other ones they're quite a bit more thick. And you're using those for the big, robust people or areas like the glutes, something that could handle like a thick needle.
Okay.
Yeah.
Cool.
So, who should not get acupuncture though? It's not something that you're using for medical emergencies. If you have a heart attack, or I have another example of the ectopic pregnancy, appendicitis, things that are requiring surgery and actual medical care, you're not going to see an acupuncturist for that. So, I think natural medicine can get a bad rep for treating things that are maybe a little bit too serious to be treated by herbs and acupuncture, right? There's definitely a category of things that should not be treated that way. So don't ignore medical emergencies and go for an acupuncture treatment if you're feeling breathless or you think you're having an ectopic pregnancy or appendicitis. It's definitely worth it to check out with your Western medical doctor before just trying to treat it naturally.
Okay.
Aside from that, it's honestly quite safe. Um, you know, there's more precautions I would say about things like um, if you didn't have proper sensation, like a neuropathy, but at the same time, we're needling to get rid of some of that numbness. So I wouldn't blanket statement that. So that's where I say just about everybody could get acupuncture. It would just be that we're going to change the technique that we're using on you depending what you have. So, for example, if you had a pacemaker, we're not going to hook you up to the electrodes, right? That like kind of pump energy into the acupuncture needles. If you have a pacemaker, we're not going to use that on you. So, not to say you can't get acupuncture if you have a pacemaker, you can't have electroacupuncture. So, there's really not too many cases that you can't get acupuncture at all. We're not going to needle over top of lesions on the skin, like open cut or something like that. Obviously, we're not going to needle into that. But for example, things like warts, I've had great success treating warts with acupuncture, and it's so satisfying. On my son being one of them.
I never would have thought of that.
I know. And I honestly, actually, it's not something that I learned in school. This is actually my own trial and error type of treatment. And both my son and I went to the doctor 3 times to get those dry ice treatments.
Yeah.
And
Been there,
every
done
time,
that.
yeah, most of us have, I think. And it didn't go away for either of us. I needled our feet 2 or 3 times, gone.
That's
It,
amazing.
it really
And it's not
was.
as painful.
It's uncomfortable in the bottom of the foot, not gonna lie, but I do feel like it's a 1 second to get it in there and then you're good, as
Yeah.
opposed to the one like the 20 seconds, 30 seconds that they're leaving that ice on
Freezing.
there for.
Yeah. Oh
Yeah.
my
So
God.
yeah, I would agree. I think it's probably a less painful treatment. Um, and yeah, so you're needling right into oftentimes you can see like those little black dots,
Mhm.
which is the blood vessel that's actually feeding the wart. And so we put needles into those little vessels and like, cut them off and gone. So it's worked
Oh,
twice with my own and my son's. So very
that's
quick.
amazing.
Yeah. Yeah.
That's a good tidbit there because
Yes.
everybody can experience those anytime.
Yep. I was a dancer. I had a lot of them back in the day.
Oh,
So wish I would have known. So what are some things that acupuncture can treat? The most popular one is definitely the musculoskeletal. I think we've all heard about getting acupuncture for sore muscles, right? Um, Pregnancy and postpartum is a wonderful area. And I should have actually added in there menopause and menstruation. Menstruation, like the
Oh.
female cycle in general, whether we're talking about menstruation, perimenopause, menopause,
So
postmenopause.
PCOS,
Yes. Yeah, PCOS, endometriosis.
fibromyalgia.
Yeah, that's actually some I should be in big stars and bolds that like that's what it can treat. Like,
Well, that's a big concern for women.
yes,
There's so many experiencing it.
we have a lot going on and we can tell so much about a woman's overall health just by her period or how she's experiencing menopause is still an indicator of what's going on in the body as a whole. So I love that about being a woman is like we can just ask questions about the period and we know so much. With men, there's a little bit more like sifting that has to happen because it's not just like this one clear sign.
Yeah,
So with women,
absolutely.
as we age, we tend to lose our yin, right? That cooling, juicy substance. And that's why we're feeling so hot. We're
Oh,
getting
hence
hot
the hot
flashes.
flashes.
Yes. So we don't have that yin like cooling us down. And then you might notice that with men, when they get older, well, they're having like the erectile dysfunction. So they're not having the yang, the energy, right, to
Okay.
boost themselves. And also, you might notice that men, they get a lot more like quiet and cold in their old age. These men that used to be like really robust and, the life of the party start to get quiet and calm. And so men turn more yin and women, we turn more yang. All of a sudden, we're like, I'm over being the mom, I'm over cooking. And we kind of get this like new attitude about us. So it's kind of interesting that how that happens. We sort of like switch roles over time.
Yeah, that's interesting.
Yeah, I find that super
Okay.
interesting.
More
So,
people should be doing this then so they can get back to that. Does it give you, like, bring you back to a balance in your yin and yang? Yan?
yeah, yeah, young. Yeah,
Yang.
I know it's counterintuitive at
Yin and
first.
yang.
Yeah, this is definitely like the things that we would be working on is bringing
Okay.
that yin back into the body through acupuncture and also through herbs and dietary therapy. We can definitely improve that. Women in the East, their experience of menopause is nothing like we talk about in the Western world. Like, if we are, like, I think it doesn't need to be such a terrible experience like a lot of us have or have heard of. If we keep things in balance, it shouldn't be so bad, right? Apparently, women in the East just have like a much easier time than we
Oh,
do.
well, that's good for them, not
Good
for
for
us,
them, yeah.
but good for
But for
them.
us, we can do acupuncture, and
Yeah.
so yeah, thank goodness for all of the tools and modalities that we do have.
Yeah.
Mhm.
True.
One of my favorite things to treat with acupuncture is always like mental emotional disorders, anxiety, depression, insomnia. I love all that stuff. So acupuncture needles are most definitely turning on the parasympathetic system, which we all need to tap into.
Mhm.
We're all in this fight or flight or fight or freeze. And we need to come back into the healing state, the rest and digest, so that our body can heal themselves. And so acupuncture needles, that's the epitome of what they do is turn on that parasympathetic nervous system. Um, you often hear of a term called acu-high, and you kind of come out feeling like a little out of it because you've just turned on this relaxing system and you walk out and you kind of feel like a little bit dazed. And what's interesting, I don't know if you're familiar with the endocannabinoid system. We have like these THC receptors, right? And so when we are doing acupuncture, we're actually turning on the endocannabinoid system. And so now there's actually theories that this acu high that they're talking about is actually the endocannabinoid system being turned on,
Oh,
you know?
that's
Um,
pretty cool.
yeah. So almost getting into another area there. So
So does this also help with like PTSD?
definitely. Yeah. Um, because we're going to work to calm that anxiety and like the overactive brain. So I think with mental emotional stuff, it still is important to to speak with counselors and psychologists,
Mhm.
um, and potentially get another view on them. I'm not saying that some people don't need a different type of support, or I know there's different modalities for the PTSD, like we were talking about some alternative therapies.
Yeah.
So I just like to put a disclaimer on that, not to say that maybe don't reach out to a counselor if you're already seeing one,
Well, this
that
to
you
me
can
is
still
like
follow it.
a complementary therapy to go with what it is that you're doing.
Exactly.
Yeah.
Exactly. Yeah. You might need to talk through some trauma, right?
Oh, yeah.
But not to, yeah. So acupuncture can definitely assist in that. And it's also really great for addictions, like strong addictions, as in crack cocaine, even as strong as that.
Oh, wow.
Yeah.
So you can fix my sugar addiction easily.
Yeah, no problem. They say sugar's harder than crack cocaine to get rid of that addiction.
Well, yeah, because it's everywhere too,
Yeah, yeah.
and it's in
So
everything.
yeah, exactly. It's yeah,
Yeah.
secret little nemesis everywhere.
Okay. Well, that's good to know about the addictions because I think sometimes just recuperating from an addiction is great, but
Yeah.
to go a little further, this is a good thing.
Yeah. It's gonna help rewire the brain, right? And
Hmm.
if you've never been able to slide into a parasympathetic state, this is just like a little preview to your body that it's possible, you know, and build upon that neural path.
Yeah. Well, that's good.
Um, I guess some less common things that maybe you haven't heard of for acupuncture is
Yeah.
something like stroke recovery. So, after a stroke, the facial muscles can be drooping and lopsided. We can actually help to restore the facial muscles.
Oh my God.
Yeah. Like I think that one is like a game changer. Or aphasia, like you can't talk after the stroke. You can help with that with acupuncture as well.
Wow.
Super cool. Yeah.
Yeah, I don't think I've ever heard that before. So how about
Yeah.
if somebody had a stroke and they're blind in one eye?
I think I think there would be potential for that to work, because we can definitely work with eyesight and vision. I've never heard of somebody losing their sight after the stroke. That's something I actually haven't seen personally. So I haven't seen it work in my own clinic, but not to say that it wouldn't, right?
Yeah.
Yeah, yeah.
You can't
Um,
know unless you try.
exactly, exactly. Yeah. And then there's the things like the kidneys and the gallstones. Um, we would oftentimes have like a build up of the yin is some of the that stones, right? Is or like cloudy urine. This is definitely like an aspect of like the damp, that I have mentioned in the past with you before. Yeah, that dampness and then everything kind of like accumulates. So using acupuncture and herbs, we can help to dissolve those stones, get rid of that dampness, and kind of correct that urinary tract function. UTIs is a big one too, and incontinence.
Some of
In
these are sounding like my mom because she's a speaker.
yes, yeah, I know she checks a few of these boxes
She's
here.
checking a few of these boxes.
Yeah,
Yeah.
yeah. We went into like the libido and erectile dysfunction a little bit for a second there, so that's yeah, that's definitely a thing. Or even a lot of women with the perimenopause, menopause is vaginal dryness is something that a lot of women complain about. So that's even something that we can tap into.
Wow.
Yeah,
Well, and I
again,
think this is good for men then if they have ED instead of taking something or thinking that it is something that's never going to change.
totally. Yeah, something that's out of their control. Yeah,
Yeah, exactly.
yeah, yeah. There's definitely things that we can do, and that ED is often linked with something mental emotional too. So we can tap into that.
True.
We talked about the warts. Athlete's foot is another one that we could get into.
How
Um,
about what is that?
when the feet kind of
Fasciitis?
start to peel, almost like
Oh,
a little bacteria.
okay. So can you work with like arched feet or
Bunions.
something fasciitis?
Oh, plantar fasciitis.
Yes.
Oh, it's absolutely.
A lot of people have that.
Yeah, absolutely. Plantar fasciitis is a common one for sure for acupuncture. Yeah. Yeah, it involves needling into the feet and also into the calves. calves are kind of left out of the equation a lot of the time with the plantar fasciitis. But if those are tight, you can imagine how those muscles are kind of pulling on the foot. If they're shortened, then it's going to be pulling pressure on the bottom of your foot.
Okay.
So yeah, kind of working on
Wow.
both of those.
Yeah, I know some people who have that. So
Yeah, I know a lot of people who do. And proper footwear is big. And also, the feet is just everything. Everything starts at the feet. And depending how, your step is going to affect how your knees and then your hips and then your shoulders. So the feet are just very important to look after in general. And on a note of that is like just always being conscious of where your weight distribution is in your foot.
yeah.
And you can kind of notice on yourself, do you tend to go towards the outside? Do you lean on one leg? These are all things that are going to affect you from the feet up.
Yeah.
But back to acupuncture, it can also restore consciousness. So if somebody has passed out, you can actually revive them. So not in the case of an alternative to CPR. That's not what I'm saying. But like, well, for example, I was getting my hair bleached once, and the pain made me pass out. And so, in that type of unconsciousness, we could do a needle and revive the person.
Oh my God. Well,
Yeah,
that's just a scary story in itself.
I know. Hopefully, no one else experiences that. The things we do for looks sometimes,
Yes.
but hence why my hair is no longer bleach blonde ever again.
There you go.
Yeah. So yeah, so there is that. I always keep an acupuncture needle in my car, or like if I'm traveling in my suitcase in case like a medical emergency happens. Oftentimes there's something that you could do with it.
That's cool.
Um, so Chinese medicine, traditional Chinese medicine is more than acupuncture. Like I was talking about, kind of it being under an umbrella. We have the acupuncture needles themselves, and then we have Chinese herbs, and that is a whole other medicine in itself, treating things through herbs. So I won't go too much into that today. My focus was more on acupuncture. But when you hear the term traditional Chinese medicine, just know that that includes acupuncture, and it also includes the herbs that you see all the time downtown in Chinatown. That is part of TCM. Um, what also goes hand in hand with TCM is always going to be dietary therapy. If you ever see an acupuncturist, 9 times out of 10, they're probably going to tweak something in your diet or give you some type of suggestion of what you could add in or take out.
Oh,
Um, we're also looking at things like lifestyle and activities. So if you're a person who's struggling with digestive issues, you oftentimes have loose stools. We're going to be looking at your lifestyle. Are you too busy? Are you doing too much and you're draining too much of your energy? Could you be doing things more like yoga as opposed to working out rigorously? Maybe that's not what your body needs at this time. So that's what I mean by lifestyle and activities. Um, and sleep. So in Chinese medicine, we really want to be asleep by 11 o'clock to allow, I'm terrible at this. This is like bad TCM girl because I don't go to bed till 12, 1 o'clock sometimes. I'm really
oh,
bad for this. And I'm also really bad for eating late. But in Chinese medicine, in the perfect world, we would be asleep by 11 and not really eating after 9 o'clock and just give our bodies that time to actually rest and digest and not interrupt our sleep. So if you find that you're waking up a lot in the middle of the night, it could be that you've eaten too late, but that's also the time of the liver and the lung. So if you're dealing with a lot of emotions, either stress or grief, that will oftentimes be what is waking you up, or the lack of yin nourishing your brain and keeping you calm is kind of aspect of the sleep part of this. Um, and another part of the lifestyle and activities is actually your sex life. You can be having too much sex and taking away the energy and the essence in your body, especially for men. with their every time they ejaculate, that is them ridding essence in their body. So
Oh,
in Asian cultures, it is like preferred that a man only ejaculate like once a week, whereas you would hear in Western lifestyle, this is maybe more of a daily thing, if not more. You know, so if a man is having low back pain or anything going on with like his reproductive system, we would need to ask, like maybe if there's overwork, oversex is like a very common theme and trend that you would see. So
I
that's
never would have thought that, but you know what? It makes sense because it's just energy. You're exerting the
exactly,
energy and it's leaving you. So that makes sense.
yeah, and substances are leaving you. Yeah,
Yeah.
yeah. Um,
That's interesting. I've never heard that before.
Yeah, it's really interesting. And that's where I say like this Chinese medicine, this type of medicine is just so broad spectrum and it encompasses every single part of your life, from activities to food to exercise to everything, right? It just it's a whole body
It's
picture.
more encompassing versus going to a doctor and them saying, having 10 minutes with them and you're trying to explain this thing and they're like, okay, got to go now.
Yes.
You can't really explain everything to them.
Yes, and they often it's a plus B equals C type of equation. I find like you have this function and you want to turn that function off, and I'm going to give you this to turn it off, but we're not addressing why did that need to be, why was that turned on in the first
Yeah.
place, you
Yeah.
know? So that's what I think the difference is
Getting to the
getting
root
to the
cause
root
of
of the
it.
problem.
Yeah.
Yeah, this is a preventative medicine as like the definition
Yeah.
of it. It's a preventative medicine.
Yeah. So if you don't want to be medicated for the rest of your life for things
Yeah,
that you can actually take care of, this is the thing to do.
exactly. I
Yeah.
mean, there's always something that can be worked on. The yin and yang are always shifting, always moving. We're always in different times of the season. There's always something that can be done
Yeah.
for sure. The work is never done, but that's kind of the beauty of it too. Is like healing is always possible.
Yeah.
Yeah, improvement's always possible. And then
Yeah.
that was
We
kind
don't
of
have
my
to be
last.
stuck being sick.
Yeah, yeah. No, we can change that, and you know, whether you want to call them miracles or not, they happen. You know, things that people were told they were never going to do, people told they were never going to walk again. They're walking, and so these things happen for sure. So don't lose hope. Don't
Yeah.
lose hope. Um, and yeah,
Hope,
kind of
hope keeps
like
us going.
yes. And that was my last point of that. Just that there's a large correlation with the seasons and the elements of earth that we're using within Chinese medicine. We're going to treat you according to the season and the time of year that it is also.
Okay.
We could even go down as far as time. Each organ is optimally functioning at a certain time. So, for example, your stomach is functioning best from 7 to 9. And so if you were having stomach issues, that would be the ideal time to treat you, would be the 7 to 9 a.m. time. Yeah. So if you want to get down into specifics, we would go from like the season all the way down to the time of the organ too. If that makes sense.
Yeah.
I kind of touched on that already, like the difference between the dry needling and intramuscular stimulation. So the physio style acupuncture, as opposed to now, I think you can kind of see the difference of the traditional Chinese medicine way. We're looking at so much more than, oh, your shoulder's sore, so we're going to put a needle there. We're looking at so much more than that.
So yeah, they're just looking more at releasing muscle and tension
Yes.
versus what you're doing.
Yes.
Okay.
First, why did that tension get there in the first place?
Mhm.
Um, and just I mean that whole other broad scope of practice that we can tap into with all of the organ theory and all of that. There's just so much more than musculoskeletal stuff that acupuncture can do.
Yeah.
um so really common question, people who are scared of needles, how can they use traditional Chinese medicine if they don't want needles or they're scared of them? And there's lots of ways that we can still use this medicine to help you. First one being acupressure. So we are just literally going to be putting pressure into all the acupuncture points that normally we would needle. We're just going to use pressure on them instead with like fingers or different massage tools are different ways that we can stimulate them. You're not going to get as deep of an effect. You can imagine, obviously, all of the layers and tissues that that needle is going through, as opposed to just my pressure. It's going to be, it'll be different, right? So we might not get as strong of results, but not to say that we can't get any. And acutonics or tuning forks, that's another way that we can stimulate the acupuncture points. And it's essentially using vibrational frequency to vibrate the cells at a healing frequency. So you can just instantly feel the calm in your body when you're using the acutonics. And I think a big effect of that is because of how much water we're made up of. And you can imagine the ripples in the water are the same with our body with these tuning forks. So that's another way to stimulate them.
And it's nice.
And
I
it
like
feels
it.
so good. I think it feels so good. Um, Another thing, they're called seeds. And what they are is, again, another way to stimulate the acupuncture points. And what they look like is a tiny little square band-aid with a little bump on the back of it. And it is actually made up of, it's not just plastic. It's I believe you pronounce it Varsilla seed. So it's actually made up of a specific substance. It's not just plastic that you're putting on, but you're going to stick this onto the acupuncture points, often in the ear. That's why I'm pointing to my ear, but you could place them anywhere. And you're kind of pressing into them throughout the day and stimulating your acupuncture points that way through these little seeds. Yeah.
So you keep it on.
You keep it on, and you would keep it on for, maybe 5 days at a time. Yeah. So that's a really good one. I find for not for anything, but definitely for sleep. I find a lot of people like the ear seeds. There's another thing that's called moxibustion, and what that is healing the body through heat, essentially. And moxibustion is done with mugwort, and that's a really warming herb. And what we would traditionally do is light the mugwort. Yeah, it's in a little ball, and you light the mugwort on fire, and you put it onto an acupuncture point, and that warmth is penetrating very deep into the body. And we can treat things like musculoskeletal pain with this. So we're helping like release that tension with heat and drawing it out through the acupuncture point. But it's also a beautiful way to bring energy back to the body. So we're talking about losing our essence and losing all of these things. A really classic example would be childbirth, when we've just depleted ourselves almost completely. And the moxibustion is going to help replenish us again, bring warmth back into our body, and like bring this vital chi back. And so there are certain times of the year that is called moxa season, when they say the gates of life to our body are wide open, and that moxa just goes like deep, 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 deep penetrating into the body. It's the best time of the year to do it. So the two times are around the Chinese New Year. We just kind of passed this season. And then about the whole month of November is the other moxa season. So it's that transition before winter time that we're looking for. Yeah. So those are ways that you can replenish your body without using acupuncture or anything. Moxa is probably the most relaxing, nourishing treatment that you could get. Like, this feels really nice. You wouldn't want to do moxibustion if you were really hot, like if you were just a person who has too much heat in the body. Trying to think of like a specific reason. Like, you obviously wouldn't want to put on areas of inflammation. You just had sprained your ankle and you actually have an inflamed ankle. We're not going to put more heat on it, that kind of thing. Yeah, but it's a pretty safe treatment. It's a good one. If you can't do acupuncture, we can also work with your dietary therapy. there might, and I don't mean dietary therapy as in losing weight. That is definitely one thing I want to be clear about. When I say dietary therapy, it is what you are eating and why you're eating it. So I was telling Kelly before this that, for example, I'm a person who I cannot gain weight to save my life. If anything, I'm actually trying to gain weight. And so for me, having things like cold salads and cold shakes and stuff is really hard for my body. I'm already cold and I already have a hard time processing my food. So that's not going to be good for me. Um, Things like that. So it's definitely not in terms of losing weight specifically. Um, I find that, for example, things like eggs and bananas are actually known to be very stagnating. So if you have a lot of pain and really stiff muscles, sometimes actually eating eggs is gonna make it worse. And so these are some of the things that your acupuncturist might tell you that you would never expect them to tell you not to eat. So it can be, yeah, sometimes some counterintuitive things. Or we can just tweak what you're eating. So in terms of different meats, the most yin type of meat is actually pork. And then the most yang type of meat is chicken. So even in terms of like what meat you're eating, you could, switch it up and get a little bit more benefit. For example, and to explain why that is, like everything goes into like the nature. And so you know how like chickens are they're fast and they're like kind of all over the place. And then you think of pigs, they're like very like slow and big, you know.
Mm-hmm.
So these are kinds of the things that go into to some of these theories. So winter time, it's a good time to eat pork. It's like or sorry, summertime, it's nice to kind of cool the body down a little bit to eat the pork.
Oh, what about beef? Is that not?
And uh beef is like kind of more on the yin side too. It's like right in the middle. Pork is like the most yin, and then beef sits in the middle.
Okay.
That's kind of like a good
Because
all
most
around.
people eat a lot of beef. So,
Yes, yes,
yeah.
Alberta.
Yeah.
And interesting tidbit about that, I was a hardcore vegan for a few years. Like when I was a person who never thought that I would not be vegan, very adamant about it. And being in this program actually changed that. And we had to do a dietary therapy um, project where we changed something in our diet. And for me, I was actually feeling kind of depleted and tired. My skin was quite pale. And so the two things I wanted to try and add in was bone broth and eggs, even though, I mentioned about the muscle pain, but not a blanket statement, but just an example. But for me, I added in eggs and bone broth, and it was like a night and day difference. I went to school the next day, and everybody was like, "Wow, Brittany, like I can see the difference in your complexion." It was like a tangible change, and I haven't been vegan ever since. And
That's
now I start eating
interesting.
weird things like the organs and all the random bits that I never thought I would ever get into. So
Wow. That's interesting because you hear certain things and we're not really going by our own specific body. We're going by what somebody else might be saying that we should do.
yes. And I think maybe vegan diets work for some constitutions, but when I'm talking about me being this frail tendency to be a frail person, it didn't work for me. So that's definitely not to say it doesn't work for everybody. I have a really good friend who's also a traditional Chinese medicine practitioner, and she is vegan, and it seems to work really well for her. So definitely to each their own, but
Yeah.
it's worth it to look into your diet if, like you say, you're just kind of following what you think you should do. And sort of it's this guilt that is preventing you from maybe looking at other options. I think it's worth it to check out other options because, like I said, I was a die-hard vegan, like I was, angry vegan style even. And it amazes me that I'm not vegan. Like if you would have asked me at that time if I was ever not going to be vegan, I would have said no. And here I am, like I said, eating all the bits and parts of the animal. So
Well, and yeah, but you're feeling the energy. You're getting what your body needs.
Yeah. And
Yeah.
I think sourcing is huge, right? I think it's the factory farming that's really killing us. And it's like if you're going to a farmer and you're getting like nice grass-fed meat and this cow, this animal has had a good life, I think that's very different than yes, ingesting this animal pumped with antibiotics and all the things. So I think responsibly sourcing your food is a whole other thing
Yeah.
and can be hard, especially with our economy. And I know it's expensive to do that. So I think just do your best. I see a lot of people struggling with diet because there's so many conflicting
Yeah.
theories
It's a
out
big
there,
one.
right?
It's a
They're
big
like,
one.
oh, do
Yeah.
I eat apples or apples are bad? Or broccoli, okay, that's not good anymore. What do I like? I don't know what to eat. And I think you just need to do your best. At the end of the day, if you can afford to have some veggies on your plate and I think we overthink it too much and just do your best, do what you can afford and do what feels good to you. And I think we generally know what's a ultimate no, right? Like we know the junk food and all the middle aisle stuff is basically no good. So my opinion is stick to the basics when it comes to dietary therapy and don't get overwhelmed because that's,
Because it can be.
counterproductive.
Yeah.
Yeah. Yeah. Um, and then my other point about getting acupuncture was that I think it can just take you being comfortable with a practitioner. I have so many clients who just started off as massage clients for a solid 5 years, and then they were ready for me to put some needles in. So sometimes it's just finding the right practitioner and just giving yourself time to warm up to the idea. Once that trust is there, you might be a lot more open and willing than you ever thought you would. Because I'm talking people who had like major needle phobia, like never in a million years were they going to let me put a needle in them, and we're doing it, and now several of them. So it
Yeah.
happened for sure.
Well, that's good.
Yeah.
Trust is a huge thing.
Yes. Questions. That's kind of all I have. Where am I at with my 10 here? Pretty good.
Well, it says 10 out of 18, though.
So that's as far as my own goes, and then it was different templates.
Oh, okay.
I just didn't delete them all. Yeah, into living room designs.
There you go.
Yeah.
Well, that was good. Is there anything else that you might have thought you might have left out?
Um, I wish I would have made a more specific point about female health for sure. That was the part that I would have liked to included. We covered that pretty good, but I think a lot of women are struggling with fertility, with period pain, and it's just something that we don't have to suffer through, and we don't need to be on birth control for.
Yeah. Well,
Right?
maybe then you need to do one just on women's health,
Yeah, yeah, actually.
right? Because we are struggling. They're just slowly, very slowly
Mhm.
getting into looking at that our bodies are different. Hello, yes, look.
Yeah, amazing. Yeah, exactly. It's
Yeah,
this whole other system, kind of like we
yeah.
were talking about.
Well, yeah, because we don't have a heart attack the same way a man has a heart attack. So I'm
Exactly.
assuming we don't have a stroke the same way a man has a stroke. But
Yeah,
everything is
yeah,
directed by the male body versus no, women are different.
yeah.
We also, because of our period, we also have other issues because we can be more low on iron
Mm-hmm.
because of our period.
Yeah. Oh, exactly.
Yeah.
Yeah, touching on that point, like women, like in Chinese medicine, women are just prone to these blood disorders, whether it's blood stagnation, blood deficiency, what have you. Women have blood issues, and men seem to have chi issues, energy issues. Yeah,
Makes sense.
it does. It does.
Yeah. Well, yeah, because if you can come up with something like that for just women, that would be amazing because I think no matter what age you are, you struggle because there's so many things women are going through at an early age.
Yeah, so young, like
So like my age when you're in, past menopause.
right. So it's just like, a solid like 50 years of our life essentially that we're going through all of these
Well,
changes.
yeah, and some of these girls are getting their periods really young.
Yeah.
And is that a good thing? And then sometimes there's like so many things like fibroids and all of these
Yeah,
things that never
exactly.
really happened before,
Yeah.
that if we can get to it and help,
Mm-hmm.
then that's a good thing. I think it's just, again, it's education
Yeah. It's
for women. We need to empower more women
yeah.
to take care of themselves.
Yeah, for sure. Especially, yeah, when it comes to the hormones, that we have just really shut that down as like a dangerous topic and or area to delve into, you know? And so I'm just noticing now that many women are being more open to doing hormonal therapy. And, you know, that was always looked at as a bad thing. But from, and I need, this is out of my scope of practice talking about the hormones. But I have heard of some women who are delving into that area and are just finding it game changing. Because I
Oh,
think before it was just, it was a blanket statement that it's going to be bad, cancer causing, hormonal therapy, no, that big no no. And it seems to be that that is really changing. And there's a few doctors, female doctors, that are really advocating for more literature to be out there about hormonal replacements, hormonal therapy, and how it can be good. So I think it's worth it to seek out proper MDs. Like if you don't like the opinion that you're getting from yours right now, like search out other ones
yeah.
because there are some that are open to alternative therapies.
So traditional Chinese medicine doesn't work with hormones.
So we do, but in a sort of this indirect way. Like I don't want to get into talking about taking like estrogen supplements is what I'm saying,
Yeah,
and progesterone because that's out of my scope. But
yeah.
yeah, we're working on the hormones and we're talking about them in a different way. Like when we're talking estrogen and progesterone, you can equate that to yin, right?
Mhm.
When that yin is going down and when the estrogen and progesterone is going down, we're getting dryness in the tissues and in the body, right? And so we're equating that to this yin that we're talking about.
Oh, okay.
If that makes sense.
So anything is possible.
Yeah, absolutely. And Kelly, you and I were talking before about, you know, women in the East seem to have a lot easier of a time with perimenopause and menopause. And so it seems that if we can keep our body in equilibrium beforehand, before going into it, that could really make a difference in our experience of it. And it doesn't have to be as excruciating and unpleasant as it's known to be.
Yeah. And again, it's just learning and educating yourself that you don't have to suffer.
Yeah, yeah,
And so
absolutely.
women
Same thing
are.
with period pain and going back to that, you know.
Yeah.
It's
Well, I'd
just,
be interested on hearing about the period pain and the women's stuff because,
yeah, it's
yeah,
a problem.
it would be an interesting one to see. But
Yeah,
that's for another day. But I want to thank
yeah.
you
Thank
for
you.
this. I think I said asked enough questions.
Yeah, feel free to email me or anything that comes up, and I can answer them for you or anyone
Sounds
who's
good.
watching.
Yeah. So true. Well, thank you again.